okay, for all you fans of repeal and replace, and that replace part doesn't exist at this point. So let's just go with the repeal of Obamacare. It's pay me now or pay me later. So if it does in fact get repealed, you're going to have a flood of people going into the emergency rooms, okay, of the public hospitals to get treatments, not preventative care, but treatments when they are in the middle or towards the end of, minor to major illnesses. Anybody who has ever gone to an emergency room and gotten a bill, like I have, knows how expensive that can be, rather than being able to go to your doctor and paying a quote-unquote small, I call it small, $35 deductible if you have basic health insurance, to be seen by the doctor early on to obtain whatever medication or additional referrals you need in order to cure your problem. When you hit the emergency room, number one, you're going to be waiting hours and hours and hours to be seen. The bill is going to be astronomical, and I'm talking about thousands of dollars. You, if you are indigent, are not going to have the ability to pay for that. So guess who's going to end up paying for it? Your state or the federal government. Somebody's paying for that, because if those bills aren't paid, the hospitals obviously go bankrupt and out of business. Pay me now or pay me later. Here's the segment regarding the repeal, but not replacement, of Obamacare.
You're going to pay me later. The Republicans are like a dog chasing a car. You catch up to the car, and then you don't know what to do but bark, because there's nothing else you can do. These women are going to the ER. They're getting expensive services because they are at the final stage of their illness, when in actuality the states have to pay for that, and it's very expensive. So these women got Obamacare, used Planned Parenthood, got to primary care, prevented all these horrible illnesses, saved millions of lives, saved millions of dollars. So you're going to pay me now or you're going to pay me later. And if you go with the Affordable Care Act and go with Planned Parenthood, you pay a lot less and save lives. I mean, it's simple as that. It's a no-brainer.
And Sarah, you recently interviewed President Obama on this very subject of Obamacare, and his pitch to Republicans, which seems like a pretty good bargain to me. Let's listen to what the president said about the Republicans' determination to repeal Obamacare.
I am saying to every Republican right now, if you, in fact, can put a plan together that is demonstrably better than what Obamacare is doing, I will publicly support repealing Obamacare and replacing it with your plan. But I want to see it first.
President Obama is a lawyer, and most lawyers, other than in the OJ trial, never put on ask a question in court that they don't already know the answer to. So you've got to know that President Obama already knows. This isn't a glove don't fit, it must have quit. He's not going to try a glove on OJ that he didn't, demonstrate beforehand. He knows they don't have a replacement, right, Sarah?
Yeah, they have had about 6 years to work on a replacement plan, and they haven't gotten here. And I think it very much is the case. It's kind of the dog who caught the car, and they're not really sure what to do with the situation they've ended up in. I think they were just as surprised as a lot of people were with Donald Trump winning the election, and they didn't really think they'd need a replacement plan. And so you do end up in this situation where Republicans are talking about repealing Obamacare. We know they don't like Obamacare, but they don't really have a plan to fix it at this point.
And Sarah, what happens if they repeal it? Just walk us through. If it's okay, they repeal Obamacare. What happens to the 22 million people that are getting it now? They're
So
getting
most of
insurance
them
through it
lose
now.
health insurance coverage. The expectation is about 20 million people would no longer have coverage, particularly people on the Medicaid expansion. It's nearly certain they would lose coverage because these are low-income people who don't have really enough money to buy insurance on the individual market. The folks in the individual market, it might be a little bit of a mixed case. They're a little bit higher income, but 85% are getting subsidies from the government. Those subsidies would disappear, and it would become much more expensive to afford health insurance coverage.
And Perry Bacon Jr., we know that Republicans, led again by Paul Ryan, the House Speaker, sued. They actually went to court to sue to sever the government from even paying for those subsidies, to say that it was inappropriate for the Obama administration to put those subsidies in place. So they've already, and they actually were successful. They actually won in court a couple of months ago. So are we looking at a situation where Republicans are going to withdraw the subsidies that you out there that are getting your insurance through the Affordable Care Act are getting, get rid of those subsidies, and then also end the Medicaid expansion? And they can do that with 50 votes. Do they have 60 votes to pass a replacement even if they had one?
I don't think right now you've seen Senate Democrats are pretty unified in not wanting to repeal Obamacare. You've seen comments from people like Susan Collins and a couple other moderate Republicans also saying we want to hear the details. We shouldn't pass a repeal until we have the details for some kind of replacement plan. I also think, you know, because of where we are now, where Trump is president, the Republican Congress, the stories and the coverage for these last few months was all about rate increases, but the reality of Obamacare is more than half of the people in Obamacare are on it through the Medicaid program. They pay almost nothing in cost for that. And you're for the first time getting the stories of them, which is that people getting drug coverage, people getting cancer screenings for the first time. And a lot of these Medicaid recipients are in red states and are not paying anything for health care. And they probably do want to keep their health care, even though some of them, as Sarah Close reported a lot, some of them voted for Donald Trump, but they still don't want their health care taken away.
And Barry, you've been, I mean, your home state of Kentucky, there were people who didn't even know they were on Obamacare, who now already lost Connect, which was Obamacare. Are we going to start now seeing stories of people, whether it's mining families that are getting black lung disease benefits, et cetera? Is that what's now going to be on the 6 o'clock news? People who suddenly don't have their black lung benefits anymore?
Yeah, I think so. An example, in Pennsylvania, about 650,000 people have gotten enrolled in Medicaid over the last year and a half since they expanded. So 1 in 10 of those people is now in drug or alcohol rehab. So that's what they're doing. So you're going to get more. This law has given a lot of people the access to health insurance they didn't have before. I was in Kentucky, and I remember talking to a woman who said she had delayed, she never got checkups or screenings before, and then like the week Obamacare started in Kentucky in 2014, she got all these services for the first time. So I think we're now away from a political discussion into a discussion about how does it affect people's lives, and that's going to make a difference. I know Paul Ryan has had people all go call his office on this last week telling Obamacare stories about what they're benefiting. So Republicans now are in a place where they have to really get into away from the rate increases and probably a little bit to here's how I'm going to solve your health, here's how I'm going to ensure you get access to health care now, and to get away from the politics. This is a harder question for them now, is that how do they ensure people have the same access and the same low cost if they're in Medicaid that they do now in the replacement the Republicans offer?
And very quickly, Dr. Hebert, how do they do that? Because right now, the system is imperfect. There are rate increases happening for some people. But as a medical provider, what fix would you suggest as opposed to repeal?
Well, the reality is that at the beginning of this whole thing, we knew that people were going to get insurance if they had pre-existing illness. We knew that if they had no primary care, they'd get the primary care. But if you got opioid abusers now at a 740% increase getting a medicine called Vivitrol that's going to block their heroin addiction, so that's going to save their life. Not to mention, once again, the coal miners who have pre-existing illness that got hoodwinked by Donald Trump to think that they were going to get their jobs back. Now they don't have health insurance. That's a problem. So if you're a Republican and if you get cancer, you're going to lose your insurance, you're going to lose your house, you're going to lose your car, you're going to have a $100,000 bill, and then the Ryan, the Mitch, or the Donald, none of them are going to let you crash at their house. Trust me. And if the Republicans need some help, I'm right here for you because I have all the answers. Trust me.
Well, and on that note, call your congressman. Perry Bacon Jr. is sticking around.
All right, so all you people in Kentucky, Pennsylvania, West Virginia, those various coal mining states, and Donald Trump told you that you were going to get your jobs back. Nah, that's not happening. And the reason it's not happening is primarily economic. The price of coal is at an all-time low. There are coal mines up in North Dakota, South Dakota that are going out of business because the price of coal is so low. So there is no way in hell that they are going to open up those coal mines in the states of West Virginia and surrounding states to put you guys back to work to go mine something that is economically unfeasible to do. So you're going to be out of a job. You did have health care, but because you voted the way you voted, now your health care is going to be gone. You basically voted for your own death sentence.